Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Thanks so much for joining us. This is, as always, your opportunity to get your COVID questions answered directly. As you can see, we have a special guest today. Today is Tuesday, October 13, and we're really excited to have Dr. Sandra Laney with us. Dr. Laney is with the Walder Foundation, which is based in Skokie, Illinois, and you lead the Science Innovation Program there. And I'm going to tell you a little bit about her, and then we're going to hear a little bit about sort of the foundation. And then the reason that she's here is they're doing some really, really cool funding of Chicago-based research that's helping answer really important public health questions. So as always, we'll do a little bit of housekeeping. We're not wearing masks because we are socially distanced, as you can see, more than 6 feet apart. And a reminder to everybody that, you know, we absolutely want you wearing your masks when you are out and about, and keeping your 6 foot of distance, washing your hands, all those things that we know work. And we'll do a data update in a little bit as well. Also, just a reminder, you can put your questions directly in the box on Facebook. You can also put a hashtag Ask Dr. Arwady on Facebook or on Twitter, and we will be taking those questions live. Those can be for me or for Dr. Laney. So thanks again for being here. I'm just going to give people a little bit of a sense of who you are, and then we'll get into some conversation. So Dr. Laney very conveniently has background in global health and infectious disease, and actually in outbreaks and pandemics, right? And so has done field work on tropical diseases. Prior to being at the Walder Foundation, you were with the Bill and Melinda Gates Foundation, and has worked on Ebola programs, senior advisor for Secretary Clinton's Science and Technology Advisor's Office, was a neglected disease research scientist at Smith College Task Force for Global Health. Basically somebody who really knows the space of outbreaks and global health, and then has brought some of this expertise to Chicago, the Chicago area.
Yes.
So welcome. Tell us just a little bit about, you know, yourself, the Walder Foundation, and then the CAN initiative.
Okay, great. Well, first of all, thank you very much for having me here today to talk about this. The Walder Foundation is a relatively new foundation here. It's a private family foundation, and it was established by Dr. Joseph Walder and Elizabeth Walder. And we have 5 areas of focus for the philanthropy. That's Jewish life, environmental sustainability, migration and immigrant communities, performing arts, and then science innovation. And these are all related to the career and interests of the Walders.
Got it.
So my specific area, science innovation, comes directly from Dr. Walder's career and interest areas, his passion areas. He's started out his career as an academic scientist doing discovery science, and then he became an entrepreneur and started a business that creates synthetic RNA and DNA primers and probes, life science products. For research and industry. And so really the Science Innovation Program comes out of his passions there. And I joined the foundation about just over a year ago.
Okay.
And was in the midst of doing our science innovation landscape and strategy development when COVID-19 hit.
Right.
So we did a quick pivot to try to figure out what we were going to do to help Chicago respond to this COVID-19 challenge.
Right, and we had some conversations pretty early on.
Exactly,
yeah.
We did, yes. So we decided that we wanted to try to bring together the science research community with public health, and we reached out to you and to IDPH and Cook County Department of Public Health to gauge your interest in developing some kind of an initiative together that could help address the specific public health needs to help get us out of this crisis.
Right.
We kind of have, and that's where we came up with Chicago CAN. And Chicago CAN stands for the Chicago Coronavirus Assessment Network. And so that we're now funding a variety of 8 projects that have all been driven by the input from the public health departments to answer some of the questions that are needed and increase and expand the testing in a wide variety of areas.
Yeah.
And so we really are putting together a portfolio of different types of grants to try to address some of the questions that public health needs.
Yeah, and a lot of the same kinds of questions that folks have been asking us, right? Like about how are we driving particular things? How are we understanding? Like this was a way, sort of a philanthropy standing up to say, let's fund some of the people doing research here in Chicago and in Cook County to answer some of those questions. So I know some of this, but maybe give folks a little bit of a sense of some of the kinds of projects that you're funding.
Yeah, so with the input of the public health departments in terms of the areas that we were looking at, we got a wide variety of different projects, and we pulled together a portfolio that includes things like, some of them include strategic testing initiatives, especially in underserved populations here, underserved neighborhoods, to increase and understand what the disparities are with this, increase additional testing, partnering with faith-based communities, to develop testing sites in some of these cases. Some of them are looking at developing tests that people can do at home with a new saliva-based test. Some of them are really at the earlier stage of understanding more the science of what happens with the antibody response in our bodies to COVID-19. How long does that last, et cetera. We're looking at new ways of detecting the virus, both in terms of new tests, but also in terms of looking at wastewater surveillance and what that can tell us and how that can help us to identify hotspots. We're doing sequencing projects, and well, our grantees are doing these, but all in school children, looking at the virus transmission in children. All of these are designed to be engaged with public health departments to really inform the policies and probability of getting us all back to work and back to school as safely as possible to better understand this virus and the transmission that's going on.
All right, perfect. So there'll be more to talk about, but I know people will have questions about some of these things, and we can talk maybe a little bit about some of the projects and why some of these were chosen. As you know, we obviously look at the literature at a high level, right? Like what's happening around the world, what's happening across the US. We've got whole teams of people whose job it is to read the literature, make sure we're as up to date as we can be. But there are things about our local outbreak that first are they're important for decision making, but they also offer opportunities to actually answer larger questions for COVID. So they're helpful for us kind of as decision makers here in Chicago, but we want to make sure that as much as we can, we're contributing to the world's understanding of COVID as well. And so, and even thinking about how this goes long term. So, okay. Why don't we turn for a minute and take a look at our Chicago data, and then we'll come back and get to your questions. So you can start putting them in the box. So as always, chicago.gov/coronavirus is your landing page for everything related to coronavirus in Chicago. And right up at the top, there's a latest data tab. You can also get to the dashboard directly by going to chi.gov/COVID-. And if we pull up the dashboard here, a few things going on. So first of all, you will see our current positivity rate is at 4.4%. That is remaining below 5%, which is absolutely where we want it to be. Lower, of course, is better for a positivity rate, and we are second lowest of the 11 regions in the state right now. So that is looking okay. We would even like to see it keep getting lower, but 4.4% we're feeling all right about. Our testing numbers are actually really interesting here. If you look, I'm going to blow up this graph here a minute so you can see it. If we look back to what's happened really since mid-September over the last month, do you see how this is our tests per day? And just a month ago, we were averaging about 7,000, maybe 8,000 tests per day. And just over the last 2 months, this has really shot up, and we are just shy of an average of 10,000 tests per day now. You can see we're at 9,977. And there have been days where we're doing as many as 12,000 and 13,000 tests, but the 7-day average is at 10,000. So that's very good because it means that we are testing more and therefore actually detecting more people who have COVID. One of the consequences of us doing more testing is that we are also finding more cases. And so this is where sort of the relationship between our case numbers and our positivity comes a little bit into play. Because if you look at the bottom here, our daily case number is up to 364. And that's up quite a bit. If you look compared to the prior week, that's up 10% from last week. If you look at our testing, our testing is up 11% as compared to last week. And so that rise is certainly, it's concerning because we are seeing more COVID, and all around us we are seeing more COVID. But a lot of that rise, and in fact really the bulk of it, is really being driven by doing some more testing. We've known all along, and maybe we'll get to this in a minute, there are some interesting tests, some interesting things that are happening looking at antibody tests, right? Which again, reminder, this is not people who are sick right now with COVID. This is the blood test that says, was I exposed to COVID in the past and recovered and have probably some degree of immunity? Still questions about how long that lasts, how good it is. And there have been some studies that have come out, you might have seen. So looking at this across the country, where broadly, there are some states that still look like they only have 1 or 2% of their population that has the antibodies, the signs that they've had exposure, up to, in the East Coast, New York, New Jersey, it's more in the sort of 25 to 30% range. And here across all of Illinois, a couple of these studies have put us in about 11% range. But that was a month ago or even 2 months ago. And that does continue to go up. We would expect that to be higher here in Chicago. And as a reminder, here in Chicago, approximately 3% of Chicago's population has been diagnosed with COVID. But we estimate that at least 5 times, somewhere between 5 and 10 times, and our guess based on our death rates is it's somewhere in the 6 to 7 times range, have actually had COVID. So even though 3% have been formally diagnosed with COVID, we know that at least 15%, and if I had to take a guess, somewhere in the probably 20, I'm guessing it's about 7 times, so somewhere in the like 21%-ish range probably have had COVID. And there was just a study that came out just in the last week or two where some local antibody testing, including in some of the zip codes that have had a lot of cases, that did find about a 20% positivity rate. And so as we test more, we are detecting more of those people. And that's where it gets a little complicated as we're looking at sort of how things are going. But that's at the highest level what's happening with our data. I do expect that case number to continue to go up because the testing number is going up. And as long as our case number is going up, but our positivity number is going down while our tests are going down, we sort of compare among those, we still broadly see the outbreak in good control, although there's always room for improvement. And Illinois did set just yesterday the record for the highest number of cases as a 7-day average that have been reported, really going back to the beginning of the outbreak here. If we're at about, if say we get to around 400 cases, that's still only about 40% of what we were at our peak. We were at about 1,000 cases a day at the peak. So we're in better control than some other areas are, but still, cold weather's coming and there's lots of trouble around us. So it is the time to be doubling down on the things that we know work. Wearing the masks, doing the social distancing, all of that. So anything you want to add to some of that data or conversation just before we get to questions?
just quickly, one of the things that I think makes this virus so dangerous is its stealth, right?
Yes.
It's hiding amongst us because so many people have the virus that just have mild or no symptoms at all.
That's right.
We can't necessarily see it. And so, as you know, getting eyes on it is critical and important to attacking it.
Yeah.
So the testing and the increase in testing is really, really important to keep going so that we can kind of get our hands around this virus and understand it.
Yeah, absolutely. Okay, so we're getting some questions in here. So here's a question. Let me just choose lots of things. Let's talk actually a little bit maybe about some more. There's a few questions about that testing piece. So talk a little bit about what you're interested in related to increasing testing access, or speak to that a little bit more.
Yeah, we wanted to expand the testing specifically with strategic goals, right?
Yeah.
Trying to understand both what's happening in some of the neighborhoods that have, an increased impact from this virus.
Yeah.
So how do we get better testing access, but also more information about what's really going on there. The school children question, it's like making sure that we have enough children being tested to really understand what are the transmission patterns there.
Yeah, and there's a question about school kids and testing here, so.
Yeah, so it's really important, you know, Chicago Can is really about trying to attack this virus and get us all out of this situation by using science and research to inform what's happening there. And part of that is doing testing, part of that is doing analysis of the testing, and doing it in a very strategic way so that we can answer specific questions that are important to public health.
Okay, great. So I don't think, you're not funding anything related to vaccines specifically, someone's wondering.
Not
right?
specifically to the actual development of the vaccines, but some of the projects are going to tackle some of the trying to develop better trust with the communities so that we can actually deploy the vaccines in a meaningful and critical way.
Yes, absolutely. And Mary Danahy from Facebook is sort of building on that vaccine conversation a little bit. She's curious, what does a vaccine really do if it only provides immunity for a few months? Getting a vaccine to the world, so to the point of the global stuff, seems unlikely if 2 doses are required, super cold storage transport is necessary, cost is high, and production is low. So I really like this question because it's sort of asking, you know, an immediate question, but then also this sort of question for the world a little bit. So maybe I'll start, and then if you want to chime in. So first of all, if the vaccine only provides immunity for a few months, you are correct that that is not a vaccine that is going to have a major impact. So one of the reasons that vaccines take the time they take to be able to get the appropriate scientific approvals done is that you do want to be able to have followed, you know, even some of those folks from the phase 1 and the phase 2, and then in the phase 3, you're going to follow people longer forward, because a vaccine that is only good for a few months is not going to do the trick. So I think what you might be thinking about is that the CDC has sort of said for this natural, you know, questionable immunity, that after someone has been exposed to COVID, we think there is some level of protection there, but it probably only lasts, you know, they've said maybe 3 months, but there are so many unknowns about that, especially for people who have very mild cases. And we've just, you know, a reminder, this virus has not even been around for a year yet for us to even study. But if the vaccine, the idea of this is to get a longer acting immunity, not just a few months. The question, you know, will this be a year? Will this be multi-years? We just sort of don't know. So I'll start with that. And then do you want to chime in on that and talk a little bit about you know, you have a lot of experience with the international piece, and I think this is a good question she's asking.
Right. So yeah, agree with everything that you just pointed out. And there's still so much that we don't know, because we don't know, this virus hasn't been around long enough for actually us to know how long an antibody reaction or immunology might last. And so as far as deploying the vaccine, that's another big question that has to be tackled. So the logistics are very important, and which of the vaccines is going to make it, and multiple vaccines that are in trials now, which ones will actually show safety and efficacy. It's important in terms of also understanding their storage needs, et cetera, et cetera. So if it requires extremely cold storage, then that's going to be a whole nother set of logistics that has to be engaged. The deployment of the vaccines around the world, because just to vaccinate our own local area is not going to actually solve the problem, because obviously this virus is very infectious, contagious, and it will keep re-entering our communities. So really getting that vaccine out across the world is what's really going to have a big effect, and that's going to take time.
Yeah, it is. And I think, you know, some of the very earliest vaccines that are in trials in the US here do have that sort of super cold requirement, and we've built up some logistics capacity to be able to handle that at the health department. And right now we're doing some surveying of, you know, hospitals and other spaces, but that ultra cold storage is broadly not available. And if it's not available here, you know it's not available in many, many places around the world. And so there are, there are likely to be, I think, different versions of vaccines that sort of get through the approval process, and they'll have to, again, have all the appropriate science done to make sure that we're confident that the safety profile is good and the efficacy or the effectiveness profile is good. But I agree that a super cold storage transport is probably not going to be the vaccine that takes us the longest distance, particularly in that international context. Okay, so we've got some questions here about, let's take this one. Beverly Stewart Williams on Facebook is asking, how do we not all catch COVID-19 when the CDC says COVID stays in the air for hours? All right, so this has been, we've been talking about this air conversation a lot, and it's been a conversation really for months. The very, very good news that I can tell you is that we've made really, really, really good progress in the US, in the world, and here in Chicago doing these basic things that significantly drop the risk. We were just talking to the folks at Argonne who help with our modeling last week, and just looking ahead, where are things potentially going? We know individual behavior is by far the most important thing that drives our outbreak here, more than the decisions we make about opening and closing and restrictions, although those are important. The decisions that you make every single day about if you're going to wear that mask, if you're going to keep your distance, if you're going to wash your hands, if you're going to help protect vulnerable Chicagoans are the most important factor. And the data shows that here in Chicago, we have dropped the risk of basically COVID spread. If you have one person who has COVID who is interacting with one person who does not have COVID, just in a random kind of way, we have dropped the risk of that spread happening by 88% here in Chicago compared to what it was, back in the very earliest days before we were doing any of that. And that is honestly better than we had been predicting in terms of the models. And it's, it's a sign that people by and large here have been doing a good job. Not 100% of us, but we've dropped that risk by 88%. And so, I think this air piece I know has people concerned, but the air piece is not the primary way. Where I look at sort of all the data on this, and we've talked a lot about this in prior days if you want to look back, how infectious this virus is in the great majority of the cases is really in line with diseases that are primarily spread, by these droplets. It clearly has the potential to be aerosolized and in the air. But in terms of what you can do, it's the things that we've been doing all along, and we've talked about, yes, anything that can help improve ventilation. So whether that's cracking your window or cracking your window in your car, or in some of the larger buildings, we've talked about making sure that the settings are such that we improve some of the ventilation. But in terms of the most important actions, I don't want you thinking, oh, it's in the air and we're done. No, we've shown that you absolutely can control this virus by doing these basic things, and that's been shown internationally and here. Do you want to chime in on that?
Yeah, and the only thing I would add is that, hearkening back to the last question about vaccines too, it's really going to be important that even once the vaccines start to come out, that it is going to take a long time to really get deployed, and that it's going to be critical to keep up these good public health measures of washing your hands, wearing your masks, social distancing, et cetera. So yeah, I mean, we definitely can get through this and to the other side of it. And one other thing that I want to just address briefly, that the Chicago CAN initiative is, it's designed to be a very collaborative initiative. So both collaborating between the research scientists and public health, but the community as well, and even the different types of researchers across the board. And it is going to take everybody's doing their part to get through this. Yep. And then another aspect of the Chicago CAN initiative is it's also looking at trying to help prevent us from ever getting into this kind of situation again, because we've now all felt very clearly the devastating effects of a virus like this, and this is surely not the last virus to emerge. And so how do we do better in terms of building a better system to detect these types of viruses early enough that we can actually stop them from becoming future pandemics.
Yeah. So what's the plan there?
Well, the plan there is to develop a type of system that can really be serving like a surveillance system. One of the challenges is that our current surveillance system relies on people showing up at the hospitals or the doctors to identify these types of viruses that are emerging. In the case of COVID-19, what we've learned from this, and really it's about learning from this experience, is that in many cases it's mild or no symptoms, and so people aren't going to the doctors when they're initially. So it's spreading throughout the community before we even know it. So really it's getting on top of that early, and one way that we might think about trying to do this, and we're trying to start this with Chicago Can as kind of a bit of a test bed for this idea, but to build a system where you have a collaboration between public health and research institutions that have ongoing research, that are collecting samples, that at any moment they could test those samples to find out if there's a circulating virus, because we didn't have eyes on this early enough. That's what got us into this situation to begin with. So if the next one that starts emerging, how can we have a set of samples that we can test immediately to tell, is it circulating in our own communities?
Right, and this is the idea that, you know, early, like just before our outbreak started, we did, you know, stand up. We were testing people, again, only the ones who were coming in for care, who were coming in with basically flu-like symptoms. People weren't really thinking about COVID yet. This is before the outbreak, but you collect a sort of a sample of those and you do test them. Even better is if you have some stored supplies or stored samples that you can sort of go back and say, oh, there was a new virus, you know, was it possibly there? And I'll tell you what's interesting is we actually do this for mosquitoes. We have the Chicago Department of Public Health, you know, we do mosquito control, and we trap thousands and thousands of mosquitoes every year, and we're primarily looking for West Nile virus because that is known to be here and it causes people to get sick and even some deaths, and we control it. But we also have stored like these mosquitoes for as long as we've been collecting them, and we've worked even with the Field Museum and some others to kind of make sure that we have a repository so that down the line, if there are other mosquito-borne transmission, we actually have some samples that we can go back and do some follow-on. And so thinking about how to do that in a way that has all the appropriate privacy and all the appropriate like approvals and signature, and people saying, you know, yes, you can store, you know, I'm getting tested for this reason, but you can store in case there were to be a future, you know, a future issue, you could potentially check blood for that. So you know, it's one of the long-term things I'm excited about, and it would really give us a leg up here in Chicago to be able to have some of that.
Yeah, we'd like to see Chicago Science leading that effort.
Yes, yes, exactly. Okay, here's another kind of testing related follow-up. Pamela Straitman on Facebook is wondering, when do you think daily rapid tests will be available so doctors and dentists can test themselves and their employees to make it safer for their patients? And I'll take that first just to say that there are now, like really every day, we're getting more and more advances in terms of more rapid testing and different protocols. So for example, just this week, the state has received some of these rapid antigen tests, which as a reminder, these aren't the PCR, so they're not the absolute sort of best tests, but they don't have to go to a laboratory. They're like a pregnancy test. You can do it on a card. They still have to be administered with a healthcare provider. So these are not yet available for you to just take home and do at home like you would a pregnancy test. But that is a rapid test that is available sort of on the spot. And as we see more and more of this developing, increasingly, actually, there are healthcare settings that do a lot of testing already in terms of keeping their employees safe, recognizing those are higher risk settings. And one of the reasons we are seeing testing shoot up like this is all of the dramatic expansion of testing on the technology side, on the access side, and work like this that is really pushing, you know, and the health department obviously we're mostly pushing to make sure tests are getting where they're most needed. So it's been in the same way the vaccine development has been, you know, so many scientists have been working on this around the world. So many scientists around the world have been working on new testing opportunities.
Yeah, and one of the grantees from the Chicago Can initiative is actually developing, and they're at the early stage. So like I said, there's a portfolio of different types of projects that will come to fruition at different time points, but they are working on developing a new type of testing that could be exactly in the questioner's, the point of their question was, how can you have it at like a doctor's office or a dentist's office so that you're testing there? They are working on that type of test right now. They're at the early stages. It's a new type of test, but it'll also be able to detect both antibodies and virus. And it will be in this kind of format that's more like a blood sugar test or something that can be done right there on the spot. It will give you a reading, et cetera. So we do have some of that in the pipeline as well.
Yeah, so it's exciting. You know, I love sort of this where we're not just reactive, but it's like really trying to say, what do we need, and can we work with some of our, you know, amazing researchers here in Chicago to help get some of that answered. Okay, so I think there's a couple I'll just take fairly quickly here, I think, just to sort of get through them. So Donna Brown on Facebook is wondering, why do flu shots make you sick sometimes? So as a reminder, the flu shot cannot give you the flu. It is impossible. The injected influenza vaccine does not have live flu in it. It only has killed flu vaccine or just a portion that helps get immunity. But people will sometimes, the immune response that your body mounts to the vaccine will sometimes make people occasionally feel, you know, you might feel possibly a little under the weather. Sometimes we'll see people get a little bit of a low-grade fever, but usually not. I had my flu shot last week. I had a little bit of a sore arm for a day. That's the only side effect I have, and most people have no side effects, or maybe just a little bit of this sore arm. In the small number of people who may get just a little bit of a response, that's just a sign that like your immune system is sort of strong and working well, and you're protected. It does take 2 weeks though for the immunity that you get, the protection. It's not a full protection, but the protection that you get against flu, it takes about 2 weeks for that to kick in. And so that's one of the reasons we want people to be getting their flu shots now, this month, before we're deep into flu season. Because sometimes people say, you know, oh, I got my flu shot, and then like 2 days later I got the flu. Not possible to have gotten it from the vaccine, but possible if there's a lot of flu circulating. So. Just want to hit that one quickly. And Ryan McMahon on Facebook is asking, are the testing numbers on the dashboard only the PCR tests, or does that number include rapid tests? So it is only the PCR tests. It does not include, there is such a thing as a rapid PCR test, but it is only PCR tests at this point. It does not include antigen tests. Antigen tests are considered probable, and I do actually think that we've been talking with the Illinois Department of Public Health because I actually think they probably do need to be included, and states have slowly been adding them in. They're in the process of figuring out the timing for that, and will be clear when those are added in. But antibody tests are not included at any point, and they won't be, at least not in this kind of number, because this is the diagnostic number. I think antigen tests probably will be shortly, but we'll flag those separately and let you know, but otherwise they are only PCR tests. So good. And let's take, so here someone is actually wondering a little bit more about CAN here and kind of the future of this. Like, is this something that you're going to keep working on coronavirus, or is this like talk a little bit about what does this look like long term?
Yeah, so the Walder Foundation, again, is a relatively new foundation, and like I said, we were in the midst of kind of figuring out what our strategy was going to be. So we feel like it's really critical, and one of the roles, the unique roles that philanthropy can play is in responding to current crises, et cetera, and we felt it was our obligation to do that. Where we go from here is still very much unknown. We will stay in the science innovation space, but it's not clear yet how far we'll continue on with this. Nobody knows what's going to happen with this virus right now anyways, and how long this is going to happen. So, you know, we expect to be helping to facilitate and catalyze further collaboration and addressing COVID-19, and then also really trying to explore this idea of developing an early warning system so we never wind up back here again. But beyond that, we really are still very much in the learning phase of what we're going to be giving in our science focus areas.
Yep. absolutely. Andy Pierce on Facebook is wondering, maybe this might be related to the winter dining challenge that folks may have seen, is wondering about how is a closed vinyl tent better for social distancing than being inside a restaurant or a club. He says it seems it would be better to be indoors with code required ventilation and filters operating. So the dining challenge actually does require, there is ventilation requirements within those. And so I'm not sure if people have seen this yet, and there's going to be some additional announcements, but very creative in terms of how people were thinking about supporting additional outdoor spaces, but they are not sort of entirely enclosed operations. They sometimes have heating that's coming from the floor and spaces that are opening at the top. They have sides that can open, but these are not fully enclosed bubbles, definitely. So that's some of what we're thinking of. And again, there are ventilators and filters, and we're looking at some of that. But we know broadly, this is one of the reasons outdoors remain safer than in, and we've been saying that all along. As we move into winter, thinking about some more creative ways to be able to maintain some of that good sort of outdoor space in a way that can be warm is going to be a challenge. But we've seen a lot of interesting ideas in that area. And I think I'll just take one more quick one and then maybe we'll wrap up. Ken Chin on Facebook is wondering about recommendations for healthcare professionals who are administrative who tested positive for COVID. When can they return to work? Do you think 14 days from date of test is safe, or should we require a PCR test that confirms a low viral load? Okay, so first and foremost, your place of employment gets the say on that, particularly where it is related to healthcare workers, and you should always defer to whatever the practices are. But the health department's recommendation is that there is not a need for a follow-up PCR test, because we know that people can continue to have low levels of virus found for some time, but they are not infectious anymore. And so just as a very quick reminder, the recommendation for isolation for someone who has tested positive for COVID is a minimum of 10 days from when their symptoms began. If they were asymptomatic, 10 days from when their test date was, and the last 3 days of that isolation period, they must be basically recovered. No more fevers, everything resolving. And so the least amount of time that you would have to stay isolated is 10 days. The most could be a very long time if you're hospitalized and still remain ill. But if you are otherwise recovered, the public health department does not require, or in fact even recommend, a follow-up test. We recommend that minimum amount of time, obviously making sure your symptoms are resolved, and particularly in a healthcare setting, I would refer you to your employer for the final say on that. All right, so we're just about kind of wrapping up. Anything you feel like you didn't have a chance to speak about? We often end with some sort of good news or looking ahead or things people can do. Also, where should people go if they're interested in learning some more about the projects?
Yeah, so you can check out our website, walderfoundation.org. I guess I would just like to really thank you for having me here today, but really more importantly, the Walder Foundation wants to thank you for your collaboration on this effort and for all of the incredible work that you've been doing for the duration of this crisis and helping us to get out of it. And we really look forward to continuing to partner and incentivize collaboration across this city, this region, and across all sectors and the communities, et cetera, because I really do believe that it's going to take all of us together to get out of this.
It is, yeah, and thank you too. Really, this is new for us to sort of have a philanthropy stand up and say we want to partner with public health to support the kind of research that will help answer these kinds of questions and really build the science side, the research side of public health. It's some of the stuff I am the most interested in this entire response. So thanks again to Dr. Sandra Laney from the Walder Foundation. I will leave you just with a few points here. There are some press conferences happening. So at 12:45 today, the mayor with CPS is talking about some of the early numbers related to enrollment, et cetera, all the things that they're planning and working on there. And then at 2 o'clock today, I'm doing a press conference to do an update about travel orders, to talk some more about what our numbers look like and what we expect is coming sort of in the days ahead and how that fits into some of the big decisions that we're making. So if I didn't take your question on that today, it's because we're talking a little bit more about it this afternoon. So also, just a reminder, we're coming up near the end of census. We've been talking about it a lot, but the end of this month, every Chicagoan who does not get counted means that Chicago loses $1,400 in federal funding, every single person. And so we really, really need everybody to fill out the census. My2020census.gov, ask everybody, make sure they've done it. Lots of people are pushing on voting, and I obviously want you to vote, but I also want you to fill out your census. And I will also just note, I think one other thing is that people probably saw last week the Chicago Community Trust launched Together We Rise. The mayor was part of that announcement. Really $25 million in initial philanthropic contributions and corporate commitments. One of the reasons why I think we have had a very strong response here in Chicago is that we've been collaborative and coordinated from the philanthropic community, like the Walder Foundation, many others really saying, let's make sure we're working together and fitting in the investments that we're making in our city to make sure they're not just for the need right now, although that's the first and foremost, but that they can really help us build a stronger Chicago in a recovery way. And the goal of Together We Rise is really focused especially on Black and Latinx communities that have borne the brunt, of the health and the economic impacts of coronavirus, and really wanting to make sure that those communities can make a strong comeback from that double whammy. And so just, I've been very pleased to see so many partners stepping up to be helpful in ways that really will get us through this and stronger at the end. So thank you all again for joining. If we did not get to your questions, you can still put them in there. We answer questions kind of on the off days as a one-off, and probably on Thursday I'm likely just going to be on myself, and we will kind of go through some more questions in a little bit more of a rapid fire way. But I wanted to have the chance to, so have you here, and just some of the really exciting cutting edge stuff that is also happening here. So thank you again, and we will be back on Thursday. You can tune in at 2 o'clock if you want to hear some more updates from CDPH, and be safe, Chicago.